Hello, my name is Promise Ohiri. I'm a fourth year pharmacy student at Med and Métis Fish College of Pharmacy, and I'll be talking to you today about the medication Tretinoin. This medication has a couple different brand names. It could be referred to as Retin A, Atrelin, Altreno, Renova, depending on its formulation or what it's being used for. So this medication does classify as an anti-acne agent or an anti-neoplastic agent when it's being used orally, but today I'm only going to be discussing its topical use. So it is referred to as a topical retinol, and when it's being used as a topical retinol, it's used for acne, and it's a derivative of vitamin A, and it actually works by stimulating the cell divisions on your skin layer, and it increases skin turnover and eliminates blackheads and whiteheads, and also causes the rough texture on your skin to resolve. That's how this medication works. So what is this medication used for? Like I said previously, it's used to treat pimples or acne, as people might refer to it. Acne vulgaris is a more technical term for referring to acne. And then it can also be used to control wrinkles and hyperpigmentation post-acne. So the discoloration people experience after the acne or pimple has healed, this medication can be used to resolve that hyperpigmentation, and it can also be used to resolve uneven skin textures too. So what should you tell your doctor before you start using this medication? You obviously want to let your doctor know every allergy that you might possibly have. One thing we want to point out is fish allergy. Atrelin gel is a form of tretinoin that is in gel form and actually contains a soluble fish protein. So if you are allergic to fish or some type of seafoods, you probably want to let your doctor know so they don't recommend the gel form of this medication for you, which is Atrelin. And then hypersensitivity to this medication or other retinoids. Even if you haven't used this medication before and you've tried other retinoids, please let your doctor know. They might not really consider this medication for you because you are allergic to other retinoids. But that doesn't necessarily mean that this medication might not be right for you. It just depends on the person and how your skin reacts to the medication. And also, if you're taking any other drugs that might make your skin a little bit more sensitive to light, you want to let your doctor know that too. If your skin is sunburned currently at that time, also let your doctor know. If you're currently pregnant, please let your doctor know if you're pregnant or trying to get pregnant or currently breastfeeding. And then also let your doctor know if you're also taking any other prescription medications, over-the-counter drugs, natural products, or vitamins, because there are tendencies of other drugs to interact with this medication, and that could lead to some unwanted effects or side effects. So how do you use this drug? First things first, you always want to follow the directions that have been provided to you by your doctor or that are on the label of your prescription. We do recommend that you wash your hands before and after you use this medication. So wash your hands first before you apply this medication. And you also want to wash or clean the affected area before you apply the medication, okay? And then we recommend that you use just a small amount or piece size, apply a thin layer over the affected area, and you want to rub it in gently, and also follow up with a mild moisturizer. And then you always want to wear sunscreen after or while you're using Tretnoin. Tretnoin is a medication that makes the skin a little bit more sensitive to light, which people might start noticing some hyperpigmentation or skin discoloration while using Tretnoin. It might just be because you're not using enough sunscreen, or you're not using sunscreen at all. So we always recommend people to always use SPF 15 and above. We recommend for you to use, and you have to reapply sunscreen as the day goes by, especially if you're exposing your skin a little bit more to sunlight. And then if you're using this medication to help control wrinkles, you do want to wash your face. You do not want to wash your face, for at least 1 hour after putting on this medication. We do actually recommend that people wear their medication Tretnoin at nighttime instead of during the day, just because you have a lot more going on during the day. You're moving around a lot, you're touching your face a lot. You might want to wear makeup if you're a lady, or even some men that actually do wear makeup. So we recommend that you use Tretnoin at nighttime, so you're not really doing a lot with your skin. Your skin is relaxing and calming down from the day's work too. And then we also do not recommend the use of Tretnoin at least 1 hour after. We don't recommend the use of makeup at least 1 hour after putting on Tretnoin. So, which is why you probably want to put this medication on at nighttime over during daytime, and always put sunscreen on in the morning. always reapply sunscreen, as the day goes by, because tretinoin will make your skin change color if you do not put on sunscreen. It's very, very important that, you wear sunscreen while you're using the medication tretinoin. And some things to watch out for, or things to pay attention with tretinoin. So the gel formulation of tretinoin has a tendency to be flammable. So we tell patients not to keep this medication in an area where it can actually catch fire. While smoking, just make sure it's in the cool, dry area, away from fire, or away from anything, or away from light even. And then also, you want to also use this medication only for your skin. It's topical, so you cannot ingest this medication. You don't want to put it in your nose or in your ear or in your eyes, because it will burn. If it does get in contact with these areas, just make sure you wash it, you rinse it off with water really quickly, and dry the area, and just let the area settle down. And then you also do not want to use this medication for pregnant women. It's not recommended that pregnant women use tretinoin. So if you're pregnant, trying to be pregnant, or currently breastfeeding, we do not recommend tretinoin for you. So what side effects do you want to watch out for while you're using tretinoin? Some patients might experience burning or stinging while they use tretinoin. It could mean a bunch of different things. It could mean that your skin is currently broken. The skin is not suitable for the application of this medication at the specific time. So you probably want to let your skin calm down a little bit before you can reapply this medication. It could mean that your body does not necessarily like this medication. It could mean a bunch of different things. So it's one side effect that kind of lets people know when they're using medication that something is wrong, or probably they're using the medication wrong too. And it could also mean that you're using too high of a dose, right? And then also, the feeling of warmth, change of color of the skin, like I said before, which is why we really, really recommend that you wear sunscreen after you use this medication. And then some other skin reactions that people might experience could be dry skin, redness or swelling or blisters and peeling after putting on this medication. More serious side effects would be swelling of the face, swelling and tingling of your mouth or throat, chest tightness, trouble breathing. If you do experience any of these symptoms that I've just mentioned, please call 911, call the emergency room, take yourself to the emergency room. You could just be experiencing anaphylaxis, which means that this medication is absolutely not for you. And then finally, if you do miss a dose, we do recommend that you skip the missed dose and go back to your normal routine, okay? So do not use 2 doses at a time. Just because you missed last night's dose doesn't mean that you can use it in the morning and then the night again, just because you missed the dose. We just tell you to just go back to your normal routine. Don't try to put too much or too little just because you're worried that you have missed the dose. Just continue your normal routine and just try to keep up, right? And then for storage, you want to make sure that you're storing this at room temperature. You do not want to freeze it, and you always want to protect the gel formulation of this medication from heat, an open flame, or light. And that's all I have for you today. If you do need more information on the medication tretinoin and you think you might want to consider it, just let your doctor know. They might provide more information for you. If you want to reach out to your pharmacy, they can also give you more information on the medication tretinoin. Have a good day. Bye.